Thank you, Dr. Chang and PA Joseph. You guys are our wellness kings over here, and we have all of the Skinny Shot questions rolling in every single day, and so many new patients, and we're getting so many questions. I know y'all receive so many every day, so I thought I could just get y'all on here to answer some questions we've been having.
Yeah, terrific.
Awesome.
Okay, great. So one that I get a lot, especially through the DMs, is, so what is the difference between semaglutide and tirzepatide?
So at a high level, they are actually similar medications. What I would say about the difference is tirzepatide is more potent. The reason for that is because essentially it works on two different receptors in the body, whereas the semaglutide works on one. The reason why they're similar is because they do overlap. So both medications, both semaglutide and tirzepatide, work on the GLP-1 receptor in the body, but the tirzepatide additionally works on the GIP receptor. And for anybody who's just really super curious about that, GLP stands for glucagon-like peptide, and GIP is glucose-dependent insulinotropic polypeptide. So those are the different receptors, but otherwise they both function similarly to help reduce appetite, cravings. They both have a kind of like delayed gastric emptying property in the stomach, which kind of slows down the transit of food and liquids as you're eating and drinking. And then therefore both have that impact on the weight loss component. And I would see if Joe would like to add anything to that as well.
No, I think that was explained perfectly. I do know I still am a little bit dated. I use the term gastric inhibitory polypeptide. I believe that it's the same receptor, that GIP, but they recently updated the name. And so, yeah, they are very similar drugs. One thing that's awesome is with them being so similar, if you are the kind of patient that requires kind of a switch midway, that can be fairly seamless.
Nice. Yeah, that's awesome. And then so another one that we get a lot is, can I lose weight in the first month?
Yeah, I think we can both share our experiences here. I think absolutely. I try to, especially during the initial consultation, I do let people know that everyone's response to these medications is just a little bit different. And we also even see a little bit of separation even between semaglutide and tirzepatide. I like to tell folks that while yes, it's definitely possible to lose weight in the first month, sometimes we get a few folks who don't lose weight in the first month, but that's absolutely okay. I usually will encourage and sort of just remind people the first month is really about making sure your body is onboarding properly, you're safe, tolerating it, not having too many side effects, etc. And then the other part that's important to note too is obviously the weight is just one parameter that measures success. I mean, if you're noticing body habitus changes, your clothes are fitting differently, you're noticing that maybe even for some people it's like the movement and energy and activity has changed in that first month. Those are also measures of success, I would say. And some people, by the way, as another reminder, if you start working out all of a sudden and you're lifting weights and you're building muscle, well, we know that muscle weighs more. So the number on the scale may actually be the same for the first month, but that's not necessarily a reflection of, the medication not working.
Yeah. I think you worded that perfect. From my experience, I always emphasize that month one is for me, majority is tolerance. And so I always like to tell my patients to use that month one to make sure that this is going to be a safe process and to also start to form those good habits. Both of these medications, that they really are awesome tools, but they're not going to give you great results completely on their own. We still expect that good diet. We still expect our patients to stay active. And so it's very possible to lose weight month one, but I'm not really thinking about that, to be completely honest. I'm really looking for us to form those good habits and to tolerate the medication, because if we don't lose the weight month one, then, we kind of follow that dosing protocol and we can immediately increase the dose. And that's where we'll see weight loss if it wasn't in that first month.
Exactly.
Wonderful, wonderful. And to kind of piggyback on that, how much can the patient lose in total if they were to ask, how much can I lose?
Oh, like as a whole?
Mhm.
Yeah, that's actually a great question. And here, I'll let Joe take that one first, and then yeah, go for it.
Yeah, so there are lots of different studies. Kind of like Dr. Chang alluded to, the terzipatide is a little bit more potent, and so from some of the research I've seen for semaglutide, it's somewhere between 14 up to like 18, 19% of your total body weight. For terzipatide, it overlaps a little bit, somewhere between like 17, even up to like 22% of your total body weight. But again, we don't like to use these medications to solve all of our problems. They're going to be a great tool, and they're going to help you form these good habits. And so, you kind of put into this medication, what you expect to get out of it. And so I think a great example is Dr. Franco. He's done awesome. Not only has he had weight loss, but he's now building lots of muscle mass. And so we forget sometimes that it's not just a skinny shot, but he's doing his daily check-in in the gym. And so I guess a short answer to wrap things up would be, I tell my patients, if you're a couch potato and you eat bad, we'll lose a little bit of weight. If we really dive in and we form these good habits and we stay active, that's where we get those great results, and not just great results, but lasting results as well.
Yeah, exactly. I fully 100% agree with everything Joe just said. And, I will generally tell folks for semaglutide, yeah, somewhere around 15%, understanding that all those variables that Joe just mentioned are going to play in what you eat, how much you're eating, how you eat, the exercise, activity, etc. And because even in our practice, we've definitely seen folks who are, kind of in that range, and we actually get folks who pass that range. And just like Joe was saying, Dr. Franco, even on the tirzepatide side, over 20%, he's way over that number. So he's like, some people just do amazing things. They change their lifestyle, they change the way they do things, and they can have very dramatic results with that.
Wonderful. And then, so moving on, patients asking, how do I give it? Do I come in to get the shot? Am I taking them at home? How does that work?
Yeah, so it's given by what we call a subcutaneous injection. If you're comfortable giving it to yourself, you're definitely able to do that, and we'll distribute the medication a month supply at a time, or more if you're traveling or something like that. And you can give it to yourself. It comes with an injection guide there in the box if you need some guidance, and we always are happy to show you the first injection. If you're somebody who's really needle shy and you need to come to the office every week, we're happy to do that. It'll be a quick in and out. We'll just do your injection and keep you on that weight loss train.
Awesome. And then how much? How much is the skinny shot?
Okay, so yes, that's a great question. Skinny shot refers to semaglutide, and the standard pricing there is $299 a month. That includes basically 4 weeks of medication with the provider visits. So that's an all-inclusive price. It is monthly, and as we've kind of been alluding to here, there's a reason for that, right? Understanding that we might do things just a little bit differently in our practice compared to some other practices that are doing the skinny shot or their version of the skinny shot. We actually like to check in with our folks every month to see what's going on, see how they're doing. Like there's sort of an intention behind that, right? We do want to be actively participating in the management of the titrations, whatever that may look like. And in addition, as Joe already mentioned, making sure that it's safe. So that's semaglutide, which we call skinny shot, and then skinny shot plus is tirzepatide, which is $549 a month, and all those same comments there.
Wonderful. And so how does it work for patients? Can they get the shot shipped to them? Do they have to come in and pick it up? Is it all in-person consults? What does that kind of look like? What are the options?
Yeah, so
I was just going to say, as far as options, there are definitely, multiple options. One thing that's really exciting is we were able to kind of streamline our shipping process. And so we've completely eliminated the shipping fee. So that kind of goes back to that last question as far as price. For the semaglutide, it is that flat rate of $299 a month. You have the option, of course, to do like a video visit, or you can come and see us in our Austin or San Antonio offices. After the appointments, we have, well, I guess maybe not after, but during the appointments, we have options on how to get you the medication. And so first option would be, of course, we can give you our compounded version of each medication. You can take it home immediately from the office. Option 2 is we can ship you the medication. And then option 3 is we can just write you a prescription for the medication. And then at that point in time, you would work with your insurance or whatever pharmacy we send that to obtain your medication.
Wonderful. Well, those are all the questions I have today. Is there anything else that you guys would like to cover that you get a lot?
Some people, I get the question with relative frequency about traveling. And so there's a couple things there that, yes, absolutely, some people do and can travel with the medication. There's a couple of just small logistical items to kind of think through there. And primarily if you're flying and you're going to be carrying on the medication, which I think most people do, you want to have some kind of container that can insulate to keep it cold. But then the other part of that too is we will typically write a prescription, like a handwritten prescription in those circumstances, so that if TSA security stops you or asks you, you know, what is this? Then you have some notation that you can reference to tell them what that is. So far, you know, knock on wood, we have not had any issues with that at all. And we've had plenty of people go in and out of the country and, you know, locally, et cetera. So I think, yeah, traveling is totally fine from that standpoint. The other question that kind of very closely, you know, sort of in that space is, well, what happens if I am going to go on vacation and I think I may just want to like miss a week or just kind of postpone the shot by a week? It is okay to do that. And so, you know, we like to talk through that. If you're thinking about doing that, please just let us know. But it is okay if for those types of circumstances, you're like, well, I really want to just go and enjoy my time and be off the shot for a little bit. It's okay to do that. Just, but just talk to us, you know, so that we can help guide you through that.
I think one question that I get often, that some patients ask up front, some I think are a little shy to ask, but can I drink alcohol when I'm on the skinny shot? And so the way I answer that question is I always discourage binge drinking, whether you're taking the skinny shot or not. And the one thing to remember too is with food or with that delayed gastric emptying, we may absorb alcohol a little bit differently than we're used to. So the occasional beverage, you know, maybe 1 to 2 a week, I don't frown upon. I would say just take it slow and see how your body responds before you, plan to drink anymore. And then, okay, so one other thing I wanted to touch base on was, the benefits related to skinny shot. And so, of course, we want to see differences in our body. We want to see a different number on the scale, but there's so much research and publications coming out in regards to the skinny shot benefiting us in terms of our cardiovascular health. Being able to spend some time in the ER, and I'm sure Dr. Chang in the hospital, we've both kind of seen the end result of being overweight or obesity. And I think it's such an awesome thing that we have the chance to prevent things like heart attack and stroke, even improving things like arthritis, knee, hip, back pain with a single injection that is going to help somebody lower their weight. It really is awesome in terms of the longevity of their health.
Yeah, exactly. I'm 100% agreement and support of everything Joe just said. Again, we have I think a somewhat unique perspective just from our respective medical backgrounds, and definitely seeing just the sheer amount of medical illness that's out there. It is really nice to be able to have a solution here that can help prevent some of these more chronic medical illnesses and sometimes very devastating, right? And so sometimes people will ask me, what appeals to me about doing this? And I say, well, to a large degree, if I can help one person or a couple or a few or whatever percentage that is, prevent the next diabetic foot ulcer, prevent the next stroke, heart attack, whatever it is, right? Like, not only will we have done that person a great service, we will actually have done society a huge service there too. So I'm actually, in that regard, very much in support of this. And there are huge benefits. They're being studied. It's actually researched. There are numbers that can quantify the reductions in risk factors and so forth. So yeah, it's really, really nice to see this all coming out like this.
Wonderful. Well, thank you two very much. I know y'all's schedules are extremely busy, getting to all those skinny shot patients. So thank you for taking the time to answer these questions. I'm sure we'll get a lot more in after we share this with the world. And so we can keep making more with our two experts.
Excellent. Thank you, Elena.
Yep. Thanks for having us.